Welcome to Nurses Out Loud, where nurses speak truth, challenge narratives, and share the heart behind the headlines. And before we dive in, if you believe nurses' voices matter, take a second to like, follow, and leave a quick review wherever you're listening. It helps more nurses find these conversations and join the movement to bring integrity back to healthcare. Around here, we don't whisper about what's wrong in healthcare. We talk about it out loud. From the heartbreaking to the hopeful, the controversial to the courageous, no topic is off limits. We're pulling back the curtain on what really happens behind hospital doors and far beyond them. Because nurses are there at the beginning of life and at the end of life and everywhere in between. We are the hands that heal, the advocates who protect, and the voices that speak truth when silence feels easier. Our influence does not stop at the bedside. It reaches into our communities, our schools, our churches, and even the halls of government. Wherever integrity and compassion are needed, nurses belong there. And if you've seen something wrong with healthcare, it's going to be the nurses who change it. We are 5 million strong across this nation. We are the last line of defense for truth, for patients, and for the profession we love. So grab your coffee, take a deep breath, and join me for another honest, unfiltered conversation that empowers and inspires you to live out your calling with courage, conviction, and faith. Let's get this started. More 20-year-olds are coming into the ER with chest pain and panic attacks than 70-year-olds with actual cardiac risk. This is not normal. This is an epidemic. Welcome to Nurses Out Loud, Nurse News Analysis. I'm your host, Nurse Jodi O'Malley, and I've worked roughly 100 hours in the last 10 days in the emergency department because we had staffing gaps. And I can tell you this with absolute certainty. The number of young adults who cannot tolerate discomfort, cannot self-regulate, and have zero emotional resilience is skyrocketing. Today, we're breaking down why ERs are flooded with anxious teenagers and 20-year-olds, what's really driving this cultural collapse, and a real story that happened recently, and what nurses, patients, and young adults need to hear. Before we go deeper, if you are a nurse who feels that knot in your stomach when something isn't right, but you feel alone in it, that's exactly why I created Righteous RN, a training ground for nurses who want to protect their license and their conscience. We dig into real-world ethics, the 2025 Code of Ethics, whistleblowing, board complaints, moral courage, workplace bullying, all the things that your hospital ethics module never prepare you for. If you're done being the compliant nurse and ready to be the courageous nurse, go to righteousrn.com. That's righteousrn.com, where integrity, grit, and faith drive ethical care. All right, let's get into why anxiety has become the new epidemic in American young adults. In the last decade, anxiety has shifted from something you manage to something you identify as. Young people say, my anxiety, my OCD, my panic disorder, as if it's a personality, a brand, a lifestyle. And parents, you reinforce that identity. When you come in with your young adult or your teenager, you say from the beginning, she has really bad anxiety, be gentle. Or she gets triggered easily, he gets triggered easily, and she can't handle stress. We built labels, not coping skills. And now they're adults who crumble under pressure. They're coming into the emergency room, checking in with chest pain, as if they were told somewhere that if you check in with chest pain, you're going to get seen right away. And this is true because the standard of care in the ER is you have got to get an EKG within 10 minutes of a patient coming in complaining of chest pain. Once we do that, right? We have to stop almost everything else that we're doing. And we have to look at this as a possible medical emergency. But when you're seeing it over and over and over again, the fatigue gets really real. And I'm just being truthful here with you guys. I'm being really, really honest. It's like the alarms. You hear the alarms dinging all the time, and you start to become desensitized to it. And when there is a real alarm, maybe you're not paying attention to it because we are taught to put everybody on a cardiac monitor, right? Everyone gets the vital signs on their arm in the ER. And that helps a lot because we can constantly monitor patients. But when someone comes in with chest pain, you have to take it seriously. And when you're seeing these young adults or teenagers come in, you know that it's probably not cardiac related. So I want to share a story that happened recently. We had a teenage girl that came in having her nose, a bloody nose, and it did have some deformity in it, but she wasn't in any pain. Her nose was just bleeding, and she was freaking out about it. Bring her back into the hospital room, or ER room, I should say, and get the clamp. And she's like, what are you doing? What are you doing? What are you doing? And I'm like, I'm going to put this on the soft tissue part of your nose. It's okay. It's not going to hurt. And I put it there, and she's like, okay, that's all right. And the doctor ordered a CT scan because he wanted to make sure that they could see the small bones and make sure that it wasn't surgical. So the rad tech comes to get the patient and opens up the door and says, "Hi, I'm here from radiology. I've come to get you for your CT scan." The mother's like, "CT scan?" The daughter is like, "Ah, ah," and that's all I hear. I'm sitting at the nurse's station charting, and the tech says, "It's okay. It's only going to take a minute." And she's like, "Why? What is it? What are you going to do to me?" And the mother's like, "Why are we doing a CT scan?" And she's like, "To look at your nose more closely. It's 2 minutes. It's not going to take long." And she spirals even harder. Around this time, the bus load drops off 8 patients. I say that kind of jokingly, but yeah, I mean, the floodgates open and everybody's coming in to check in. And the tech, is frustrated because, again, we see this so much. And she's like, "I got to leave. I have, 10 scans that I got to do. Talk to your patient." And I get up and I walk in there, and the mother's upset at how the tech handled it. And I can totally understand. I mean, this is the sweetest tech that I've ever met, right? But again, it's this constant no coping skills that we are seeing with these teens. And so anyway, I walk in there and, knowing that this is not a medical emergency, but it's an emotional one. And I go in and say, "Honey, you have your phone right there. Just Google CT so you can see pictures and stuff. And I'll be back in a couple minutes." So she does. I walk back in the room. And I said, "Did you look?" I mean, it's like, gosh, guys, we got all this information at our fingertips, And she's like, "Yeah, I saw it. I can do it." And I'm like, "Okay, well, let me walk you over." Okay. Because I know the tech is busy and it's probably going to take a long time for her to come back. And so I walk her over to the waiting area. And as I'm about to tell her to sit down here and go back, she starts panicking again. And she's like, I don't know if I could do it. And the mother's like, "You could do it." And, I just sit there and think, like, if this was my kid, it was like, I would have had a conversation with them. And, when I gave them a few minutes to look up CT, I would have had a conversation with my kid and been like, honey, this is what we have to do. We have to find out, if this is surgical or not. And, let's talk about it. This is what's going to happen. The mother knew. Mother knows what a CT scan is because she questioned, needing the radiation. And the doctor explained it to her. And I said, okay, come here. I saw the door open to the scanner. And I said, here it is. This is it. And she just says, okay, I could do that. Like totally changed. Okay. And I sit there and think like, what fixed that? Not Ativan, not a doctor, not a workup, but leadership, logic, presence, and emotional grounding. As nurses, it does become really hard sometimes because you do see the same chief complaints over and over again. But we have to understand that every person is unique and they have a unique set of triggers and emotional responses. And it's our job to figure out what that is and help guide the care. It's very important. Instead of being judgmental, which trust me, that day was really, really hard not to be like, dude, golly, get your kid, figure this out, but I could tell that the mom was anxious too. And it's almost like, having a dog. Your dog is kind of anxious. Typically the owner is too. And they just feed off of that energy. So, as a parent, it's really important if you know that you do have anxiety or panic disorder, that you pay attention to that because you are going to pass that on to your children. And they have enough to deal with. Like, I'm not blaming this little girl. I am saying that we have got to have more coping skills. And so I sit there and think like, why can't this generation cope? And so, one, I think they were shielded from everything uncomfortable. First of all, every feeling is validated. Every feeling has to have the time to walk through and, let them feel. Whereas I do agree with that in some sense, but in other senses, it's like they have to learn to self-soothe. Okay. And so I look at, say, my youngest son. All of our kids, they go through times where they are anxious or they're fearful. And for me, I bring it back to God. Like, honey, you know the Lord, your Father, Jesus. Bring those fears to Him and release that and tell the enemy that it's not going to win. It's not going to take control of your mind and your nervous system. And that if you can release your cares unto the Lord, you can let it go and trust that God is going to get you through. That breaks that bond of anxiety and fear and panic. And, there was also a teacher that he really liked. And so this teacher had podcasts, pastor, rabbi. It was actually Rabbi Kurt Schneider, the Discovering the Jewish Jesus. He has a lot of really good teachings. And if you go to YouTube and type in Pastor Rabbi Schneider and you type in, say, anxiety, you'll have some teachings there, and it's grounded in the Word of God. So there's a lot of power that comes with that. And so before he would go to bed at night, I would say, listen to a sermon. They're 8 minutes, 15 minutes. And it would just help him to know who his healer is and who the person that can take away his cares and worry is. While I'm there as his mother to comfort him, we also have the power of the Holy Spirit to do that as well. And then I think about them growing up. They grow up online. This isn't real life. They're not allowed to be bored because they're constantly getting all of this dopamine when they go on online, or if they get a like, if they get a share on their post. If people are commenting on it, that's like instant gratification, instant dopamine response. And there's no resilience that comes with that. There's no being bored and figuring it out. What am I going to do? Am I going to go outside? Am I going to call a friend up? Am I going to read a book? Am I going to paint? They have their iPad. It's a constant source of electronic media that they are able to obtain. Again, parents, they're branding them as fragile immediately off the back. Like, hey, let me just let you know that this is what their issues are. It's a label that's put on them. Oh, they're autistic. They're neurodivergent. They have panic disorder. And soon the kids start to identify as that is their identity, that I am a person that's fragile and can't cope and have these thoughts of terror, hopelessness, dread, fear, worry, and it's okay. It's okay to sit in those feelings. Let me medicate you. Maybe we're going to give them some medications for them to cope. I mean, I also recently had a 20-year-old that came in and was totally panicked. And I said, okay, what did you do before you came here to try to calm down? Oh, I took my anxiety pill. What pill is that? I don't know. You don't know the name? No. How long have you been taking it? For a long time. And it's just like this big pharma push, like, here's your pill. You don't know what it is. You don't know how much it is, but you've been taking it for 10 years. Like, that's alarming. That's scary. And again, like adults, maybe you don't model emotional regulation. Stress parents, again, equal stress kids. And again, stop owning that. People own their diagnoses and they're like, this is what I am. This is what I deal with. I have bipolar disorder. So recently I was watching a documentary with Eddie Murphy and I had just finished this little part in the clip and my teenager walked in the room and I was like, I want you to listen to this. And so Eddie Murphy goes on to describe, he said, as a child, I would check the stove and I would check the gas and I would get up and I would check it and make sure that it was turned off. And then I'd go back and then I'd go back to the kitchen, check again. And he said, I did this every single night. Nobody knew I was doing it, but I did it. And he said, I also had this weird noise that I made, like sometimes when I was watching TV. And I never thought much about it. But one day I was watching an episode on OCD and they were labeling it as a mental disorder. And I sat there and thought like, oh my gosh, that's me. That's what I do. I do these things. And he said at that point on, I was like, F this. I ain't going to have no mental disorder. I'm not mental. And he said, and I talked myself out of it. I said, I'm not going to have a mental disorder. I'm not effing mental, is what he said, in an Eddie Murphy kind of way. And he goes, and then I stopped it. And now I think he's 64 years old. He said every night I still check the gas, but if I go and do it once, I don't do it again. And I'm like, hey, dude, like control yourself. Don't be getting back into that crap, right? And I thought, here, Ben, this is what I'm talking about. Like coping, instead of celebrating, like here in America, we celebrate these issues and you may not think you are, but you are. Instead of thinking, how can I not do this anymore? How can I figure out how to overcome it? How can I take control over this? Because a lot of times, guys, you can take control. Now, of course, there's extreme cases that, may need therapy and may need medications, but that is not the vast majority. And so what we're seeing in the ER are these 19-year-olds convinced they're having panic attacks, 21-year-olds hyperventilating over normal sensations. 22-year-olds fainting from panic, 18-year-olds unable to make decisions without a parent, 25-year-olds unable to self-soothe, breathe, and think logically. And you know what usually resolves this, again, is not meds, not labs, just an adult who isn't falling apart. Someone who can say, sit up, breathe, look at me, you are safe, okay? You have got to take control over this. You have got to control your breathing, focus on the positive. It's impossible to be anxious if you're being thankful. So sit and look at the positive. Be thankful for whatever it is. And I told a 20-something-year-old that last night, and they said, be thankful for what? And I said, I don't know. Be thankful that you're breathing. Be thankful that you walked in here instead of in a wheelchair. There's so many things to be thankful. You have to look outside of yourself and see the beauty around you and be grateful for the things that you have, because anxiety is real, but the epidemic, guys, is the inability to cope with it. And hard feelings are not medical emergencies. Discomfort is not danger. Anxiety is not a personality trait. And kids need coping tools, not diagnosis. Parents, you need to stop announcing your child's fragility and know that nurses are not emotional shock absorbers for an entire generation. And I'm not being judgmental here. I'm just telling you that this is the reality from the front lines. Guys, if this resonates with you, if you see this every shift, share this episode. Send it to your ER chat group. Send it to a parent. Send it to a young adult who needs to hear the truth with love. Make sure you're following our new feed, Nurses Out Loud, no spaces, on our podcast, because we are bringing you more short form content there and headlines that are happening basically in real time. So just more truth, more courage, and more clarity. If you're a nurse who wants to practice differently, not just pushing protocols, but actually getting to the root cause, I want you to check out Functional Nurse Academy. It's a 90 CEU training program designed by a nurse for nurses. And I'm not just promoting it, I'm an alumni. Melissa has also opened up for Christian Functional Nurse or Functional Medicine Academy. And this is for all licensed people, okay? Not just nurses. So if you want to level up your assessment, heal your patients holistically, or even start your own wellness practice, go to functionalnurseacademy.com and use my name, Jodi, for a discount. That's functionalnurseacademy.com, code Jodi. Thank you so much for joining me here on this episode. And until next time, friends, be safe, be well, and God bless.